Kia ora, I'm Yasira from Becoming Healthy, and I'm going to take you through a simple hand routine that you can do at home for your self-care. This is a routine that I teach in my introductory course to Reflexology, also in my Balancing Life as a Mum course, and in my Helping Hands workshop that I run. So we're just going to start off with a few not ingredients, but bits that you might need. I have got a pillow, as you can see, and a towel just to protect the pillow. This is mainly so I can kind of relax my hands a bit easier and makes them a little bit higher, and also some hand lotion or cream for later on can be really nice to make everything glide, and of course taking off any jewellery, bracelets or anything that might aggravate or sort of rub on you. From the elbows down we're working, so any jewellery off from that point. So first of all, we're just going to start by shaking out the hands. I'm not going to put hand lotion on yet, as I said. So just shaking out the hands to loosen them up. And then we're going to do some wrist rotations, going both directions. Just 4 or 5 in each direction. This is just sort of warming up the hands and freeing up those joints as well. And then we're going to do some hand flexors, wrist flexors, fingers up to the ceiling and down. Just keeping your own health and safety in mind. If you feel any discomfort or pain, then stop, and if you're concerned, then see a medical professional. And now we're just going to do some finger rotations, which can be quite hard on yourself, but using the pillow just to help relax. We'll put one hand down and then use the other one to help rotate. You can hold up by the thumb, or you can hold down at the base, and again just going in each direction. So again, you can hold at the tip of the finger, down the base or in the middle, and 3 or 4 times in each direction just to loosen up those fingers. Of course, I'm showing you one that you can do on yourself. You can also do this on other people, you just need to adapt it slightly. And the whole routine takes about 10 minutes. So it's a great one for when you're sitting in front of TV, that you can just relax and kind of do this in between those ads. Just rotating each finger a few times in each direction, just loosening up the joints. Just warming it all up ready. So the next one we're going to do is called a finger boogie, and what we're going to do is we're going to hold the digits or the fingers on either side of the nail bed, and we're going to do this kind of action with it to try and loosen up the finger. You can see some fingers will be stiffer than others. Might get a few cracks here, but it's a really nice one just for loosening up that whole finger. You can hear a few cracks happening with me. Of course, in reflexology, the whole body is reflected on the feet and the hands, also the ears and other parts. So what we're doing is working the head and the neck area, if we're looking at the reflexes. Another way to do that finger boogie is to actually use your hands and rotate them as well. Can be another way if you feel more comfortable doing this. And this way is slightly easier if you've already put on some hand lotion. Just rotating all of them, giving them loosen up. It's not a movement that they usually do, so it's quite a nice one to free up the fingers. And then at this point we're going to get a hand cream or oil and pop some on. You don't need to worry about rubbing it in too much, because we're going to work it in as we go along. So we're going to start off with a finger glide. So we're going to start off at the tip of the fingers, and we're going to go stroke down at least 3 times front and back, and then at least 3 times on the side. Now you'll notice I'm starting at the tip, going down to the base, and I'm actually lifting off. And this is because the downward motion is calming, whereas working upwards is invigorating. And so because I want this for a nice self-care, I'm just focusing on just going down. Also, we're dealing with the head and the neck area, so you know, the natural flow of things is to go, of our food is to go down the throat, down the neck, not back up. So at least 3 times, front and back, and then on the sides. And on the sides. And we'll do the other hand. So starting at the tip, going down to the base at least 3 times. The pressure will just depend on what you like. You may feel some tender areas, and this is where you need to be responsible for your own health and safety. If it feels too tender, then maybe stop or ease off that place. At the same token, if it feels quite nice working that area that is a wee bit tender, then you can use your own intuition whether you should work into it or not. Sometimes it can be nice to be working into those sore areas. It can help free it up. And just the final one, the thumb. 3, and then 3. So now we're going to work on the tips of each of the fingers, and we're sort of working down to this first crease, just working the whole joint and head area, and I'm just going to do a circular motion. Very tip relates more to the sinuses, so you can work up there as well, and at least 3 times again. The slower you make your movements, the more nurturing it'll feel for you and for anyone else that you're using it on. And obviously at home you can do this longer if you wish, or you can shorten it up if you need to. Just do 1 or 2 strokes. We're just going over that whole area. Just using the thumb in a circular motion. I usually end up going clockwise. Make sure you cover each area. And then on your thumb. Use your finger on your thumb. That helps. So then we've worked the head areas. Now we're just going to go across the shoulder line. So as I was saying, this is the head and the neck. This line just at the base of the fingers relates to the shoulder line. So you can work both ways here if you like. Just sweeping across on both hands. You can work all of these points just on one hand and then do the other hand. I just quite like to work the same area on both hands to keep it even. This is the shoulder line. Now we're going to work the diaphragm line, which if you imagine this is the shoulder line, then this bony, the metacarpal heads is the chest area, then just sort of, I guess, 2 fingers down from the little finger base and coming across to the base of the thumb is our diaphragm line relating to underneath our chest. So we're just going to sweep across that with our thumb. You can go both directions, just freeing up that diaphragm line. Bring it back into balance. If it's been doing some shallow breathing, it'll help it to free up a little bit and take those deeper breaths that help us get into that parasympathetic nervous system. So just that diaphragm line there. And now on the diaphragm line, sort of in the middle, or if we do Spock fingers, find in the middle there and where it bends, we've got a solar plexus point. Now the solar plexus sits behind the stomach and it's a whole bundle of nerves, but it relates to our sympathetic nervous system. So working this can just help calm that sympathetic nervous system. So what we're going to do is we're going to press in as we breathe in through the nose, and then release the pressure as we breathe out through our mouth. And we'll do it 3 times. And then we'll do it on the other hand, finding that diaphragm line that comes across, and then in between the ring and the pointer finger. And we're going to press in, breathing through our nose, and then release and breathe out through our mouth. The breathing out through your mouth also helps the parasympathetic nervous system, or that peaceful kind of rest and digest nervous system, to come into play that much faster as well. And now we're going to work the chest area. So we hit our shoulder line at the base of the fingers, and then we just work the diaphragm line here. So in between is our chest area, those bony metacarpal heads. So I'm just going to work these in a circular motion. Hand lotion helps it glide. If you need to put on more hand lotion at any point, you can. And just working right up to that shoulder line and right down. You can also just, if you want to rub up and down, you can do that. In this chest area, from the ring finger around relates to the shoulder area, so you can work that a little bit harder if you've got some shoulder injuries, rather than having to work on the actual shoulder. And the reflexes do go through, so you can sort of work front and back at the same time. So now we're going to work our nervous system, which is also where the spinal cord is. So as you remember, we said the tips of the head. So on the thumb, if we come down, that first joint is really that's the head section. This is where the cervical spine starts, and our nervous system and spine comes down and around to the base. So I'm just going to work it with my thumb. Just a few times. Again, we go down from the head down, so it's more relaxing. Stroking down, and then on the other hand, just using the thumb to stroke down. At least 3 times, you can do it more. Then, as I was saying, the whole body is reflected, so if we put our hands together like this, our spine runs down the middle of our bodies, and the outside here of our hands is relating to our limbs. So we're just going to work along here. So as I said, this is the shoulder point. The arms and legs come down here, with the feet and hands being reflected more at the base, and your elbow and knee in the middle of the hand. So just working that whole area though, rubbing up and down. And then we're going to work into the adrenals. And the webbing between the thumb and the first finger, there's sort of a triangular area. The adrenals are found in here, and usually you can find them by a tender spot. So you can look at the tender spot and then just rotate just a little bit on that. That's one way to work them on both areas. Or another way to work it, which also helps with lymphatics, is just sort of a milking action. So you're just pulling like this in that area, in that webbing. So it's more of a gentle working of the adrenals. Just working that webbing. And then just so we've covered the whole body, we're actually going to do the palm of the hand just as a big circle with the whole of your thumb. And this covers all of those other organs: the liver, the spleen, stomach, small intestine, large intestine, all of those areas. And we're going to go clockwise because that's the way our digestive system works. So the palm of the hand relates to the front of the body, and the back of the hand, or the dorsal aspect, relates to our back. And now we're going to do a little hug from the elbow down to the hands. And then if you flip your hand over, you can get the other side of your arm squeezing down. We'll just repeat that again, so it's squeezing down. This can be quite a nice one, especially if you're using your hands and your arms a lot. Loosen up some of those muscles in your forearm. Let's do one more from the elbow down. And as I said, you can do these more and make it a longer treatment if you want to. We're just showing you for this. And then we're going to hold our hands together and just feel the warmth of the hands together before we release them. Just slowly releasing them. And letting them rest. So that's a basic self-care hand routine that you can use on yourself or at home, but it's a great one for helping you just to calm down the end of the day and relax, and I highly recommend you doing it as often as you can. Thanks, and we'll see you later.